There are a couple of things that remain constant during all times, and one is having a baby. MTN's Annie Johnson went looking for some answers on delivering a child in the middle of a pandemic.
Right now can be a stressful time for anyone, especially if you have to worry about delivering and nurturing a newborn baby in the middle of a pandemic.
Actually, there are two main differences. One is that instead of having multiple people at the bedside, there's one support person, one caregiver.
And the second difference has more to do with the staff than the expecting mother.
You will still see us wearing a surgical mask. We will have eyewear on, or maybe a face shield. And then we always wear gloves, and you might also see us in a gown or a different scrub top.
Which these doctors say isn't a hindrance.
It just adds a layer, between you and the patient. But fortunately, they know us, from the office, and so we're still familiar. We're still familiar to the patient.
While there are those two differences, the doctors say the care is the exact same.
Once the baby is born and stabilized and doing great, at some point in the next, usually within the next 12 hours, a pediatrician will see the baby and do their assessment. And then, of course, if there's any interventions that are needed with the baby, we're involved very intimately as well.
If a mother was suspected or tested positive for the coronavirus, the doctors say they would be ready to treat her accordingly.
I think the biggest thing is we've done a lot of work to prepare, and we feel like we're in a good position for if this comes up, and it might come up, that we're ready to go and can take good care of those patients as well as our staff.
The doctors recommend any new moms to try to relax as much as possible and continue following guidance from their regular doctors. Reporting at Bozeman Health, Annie Johnson, MTN News.